Hello, it's Dr. Bar, and today I have searched online to see what men are scrolling for late at night, what are the search terms, and I came across the highest search terms is late at night, you've been searching for issues with ejaculations, and particularly top of the list is premature ejaculations. So today we're going to talk about the causes, understand what it doesn't mean, and also I'm going to discuss the latest treatments that possibly you would want to know about. So you're almost getting all that information online without running into a clinic and all this awkwardness and without having the white coat syndrome. So welcome back to my channel, and today we're going to be talking about premature ejaculation, some men's health topics with clarity, honesty, and a touch of fun. So we're diving into PE, premature ejaculation, which is a concern when you guys have when finishing is too quickly during sex, and this is a very common situation. So, premature ejaculation happens when man ejaculates sooner than he or his partner would like during sexual activity, and it often occurs with minimal stimulation, in some cases, even before penetration. And the clinical number is less than 1 minute. So, clinically, it is defined that if somebody after penetration into the vagina reaches a climax within 1 minute, that is the number that we consider not the normal. So, why does it happen? This is the question. So, we're going to discuss the causes now. And unfortunately, it's not just one single cause that makes that. So, that's the reason why the personalized treatment comes in, because multiple factors and the treatment is usually personalized to the clients. So, biologic factors, let's talk about hormones or hypersensitivity of the penile nerve. So, too much sensitive, as soon as it gets touched, it gets stimulated and ejaculations happen. Another reason, infections or inflammations like prostatitis, inflammation of the prostate. Let's talk about physiologic factors, anxiety, depression, performance pressure, or early sexual experience. So, relationship issues are very important, and lack of communication, stress over intimacy is a problem. Now we go to neurochemical factors. We talk about serotonin, dopamine. These are the chemical transmitters that regulates your arousal and climax. And sometimes it's just how a man's body is wired. But that doesn't mean it cannot be improved. So we're going to dive into the treatment options from traditional to cutting edge. Here we go. Now to get to the first part, once we get the diagnosis, I said we get that score, right? 1 minute or less, or not satisfied. The goal is to give you your control, your confidence back, and more satisfaction from sexual life. So, first one on the list is behavioral techniques, simple strategies like the stop and start method, that's what we call it, or squeezing technique, squeezing the base of the penis can train your body to delay the climax. So you stop and then start, or you squeeze the base of the penis to delay the climax. And that's a behavioral training technique that takes patience and practice, but it can be effective. The other one, there's a lot of it online on YouTube, you'll find it out there, is your Kegel exercises. They are helpful, they're simple, they're free online, and you can exercise 2 or 3 times a day your pelvic floor muscles. These are very important. The most important one is trying to close the sphincter as if you're stopping a pee. The other one is like squeezing on your butthole. And also, another one is trying to lift the penis up and down. So, doing these three is a Kegel exercise for men. Doing it 2, 3 times a day, that can help. So, that's taking yourself to pelvic floor gym. Counseling and sex therapy, that's number 3, where it's very important. Sex therapy or play therapy is important, and it can work wonders. It helps address the anxiety and past traumas, for example, or relationship issues contributing to PE. Now we go to the medications. Some of them I don't like. The SSRIs, these are the antidepressants like Paxil and Zoloft. These are available. However, they have to be taken every day. Unfortunately, they're not the greatest thing. I'd rather use the medication that is topical, which is the sprays or creams, and these are like lidocaine that reduces the sensation. So that would be a preferable thing to do, and you just do it before intercourse, so it is as you need it. Now, this can help ejaculation, but often comes with side effects. So, preferably, let's go to the next one. And that is my favorite procedure that is new and available for men now, and it's the P shot. So, the P shot has changed, it's a revolution in the surgical and sexual health treatments. So instead of doing surgery, which is another option for that, I would say P shot is a very minimum invasive procedure. We do it in the office. It takes about 30 to 40 minutes. The patients come in, the blood is drawn, the penis is numb, the platelet rich plasma is taken out of their blood, spun in a special machine, removing those healing growth factors. That's called PRP, and it's injected specifically in certain areas in the penis, specifically to regenerate tissue and improve function. Also, sometimes we include it in the sensitive area, sometimes with hyaluronic filler that also delays the early ejaculation. So, benefits of P shot: increase the blood flow, enhance the sensitivity, stronger and longer lasting erections, and improve the ejaculatory control. So it's quick, safe, and drug free with minimum downtime time. So you can see this is one of my favorite, as well as the exercise, because these are two things with your therapy with your partner. I think these are the best ways to address that issue. Other advances are shockwave therapy. There's another one like a TENS machine, neuromodulation device. It's a wearable, helps train the pelvic floor as well. We have a machine called Emsella chair. People sit down on it for 29 minutes, and it stimulates the pelvic floor, strengthens the muscle, improves the erections. Now, on a final note, I want to make sure premature ejaculation can feel frustrating and sometimes embarrassing, but it's nothing to be ashamed of because it could be treated and very easily kind of managed at this point. This is not something to suffer in silence. You need to discuss with your doctor, or if you're under my care, you've already one step ahead and closer. One more thing I would like to caution is sometimes premature ejaculation can happen with other reasons of ED. So it's always good to get checked. So don't forget to like or subscribe, leave me a comment if you want to listen or hear me talking about any previous topics that you'd like me to cover. I'm Dr. Barr. Stay informed, stay empowered, and take charge of your health. Thank you so much.